Hi, I'm Rebecca Phul, a professor at the University of Connecticut, and I'm a researcher who has spent the last 2 decades studying weight-based stigma and discrimination. Body weight is an emotionally charged topic for many people, and because weight is so stigmatized in society, the way that we talk about weight can be stigmatizing as well. And in the context of healthcare interactions between healthcare providers and patients, stigmatizing communication can shut down conversations very quickly. It can lead patients to feel ashamed and even avoid future healthcare. So we need to think carefully about the words and language that get used when talking about weight. What makes this more complicated is that there are very diverse opinions and different perspectives and preferences for the words and language that we use to talk about weight, some of which are perceived to be stigmatizing and shaming. So my research team has done a series of studies examining language preferences in adults and in adolescents. And what we find quite consistently is that people prefer neutral language when discussing their weight, especially in the context of how healthcare professionals talk to patients. And by neutral, I mean words like weight, high body weight, or BMI. And the words that people dislike the most are words like fat or obese, which they find to be stigmatizing and shaming. And these research findings align more broadly with the research literature. So in 2020, I published a systematic literature review, which examined over 30 published studies assessing language preferences for weight terminology. And across these studies, there's a preference for neutral terminology. Again, words like weight or higher body weight. What this review also highlights is that people's preferences for how others talk about their weight can vary depending on their gender, their race or ethnicity, their body size, whether they've been stigmatized before. And so currently there's not a universally accepted phrase or term that everyone's comfortable with. And that's another reason why it's best to default to neutral terminology and to really ask patients what words or language they feel most comfortable using when talking about weight. So in the context of a healthcare interaction, that could mean first asking the patient, could we talk about your weight today? And then if the patient gives permission, saying something like, people have different preferences when it comes to the words that we use to talk about weight. What words would you feel most comfortable with while we have this conversation? That's a much more supportive, respectful way to talk about weight. It's